Welcome back to the second part of the show today. I'm sitting here with Dr. Walter, Medical Director of Medical Aesthetics of New England, and we're going to continue on bioidentical hormone, the topic, but we're going to specifically talk about the function of the thyroid. Thyroid is one of those misunderstood glands, I think, in the body. I know a lot of women are concerned about whether some of the issues they're having is because of the thyroid. So if you could, Dr. Walter, just explain a little bit about the thyroid and how bioidentical hormones will help with the thyroid.
So when people come in to try to find out if they're low on hormones, we don't typically address the thyroid separately. We do that along with the testosterone, estrogen, and progesterone, some of the other ones, because they really all will function together. Even though some people don't need thyroid and some do, and some don't need testosterone or estrogen, we go both by their lab tests as well as by their complaints. We kind of look at the patient, not just chase the numbers. Thyroid is very important because probably about 30 to 40% of Americans have low thyroid. And just even if they're within the normal range, if we can optimize it to get them to the upper end of the normal range, they'll often feel a lot better. And some of the common symptoms that people know about thyroid is if they feel cold all the time and if their hair is thinning and their eyebrows are thinning. But it's more nebulous things too. It's just kind of the brain fog, the not thinking clearly, why did I leave my car keys? It's the third time this week I've left my car keys. Or sometimes you just have less tolerance for other people and it's just a little bit more anxiety. Those sometimes symptoms can be from low thyroid also. High thyroid, on the other hand, is sometimes you're too hot, sometimes you get palpitations and heart racing. So it's really Goldilocks. It's got to be sort of in the middle of the normal range. But a lot of patients where we do thyroid supplementation, they're actually within the range, but they're in the low end. And again, getting them to the high end will make them feel a lot better. And then especially if you add the other hormones, if they're low in that, it's kind of an overall package that makes people feel a lot better.
Okay, sure. So you said there's either high or low thyroid. So specifically if low thyroid, what would be the symptoms for low thyroid?
Again, most people are going to feel tired. They're going to just feel cold all the time. Like if everybody's dressed like me and then you're in a down jacket and you're inside, then that may be a consideration to watch for. And if the thyroid's really low, then you can start having the hair falling out. Typically, that doesn't happen so much from thyroid if it's within the normal range. But again, the thinning eyebrows, the thinning of the hair. A lot of things can do that, but low thyroid certainly can do that. And also, conversely, very, very high thyroid can make the hair brittle and easier to fall out too. So I'll go over the lab testing a little bit in a few minutes here, but it's something that we can check.
And the high thyroid, is there anything more to it other than the brittleness of the hair that are a symptom, maybe?
Again, palpitations, if you feel jittery, feel like you have too much caffeine.
Okay.
Those are the most common ones. Okay.
Does everybody need to be on supplementation for their thyroid when they do the bioidentical hormone treatment?
No, not at all. I mean, if your hormones are optimized, then there's no reason to add thyroid on.
Okay.
So that's what we look for. We look at both the symptoms and, again, looking at the blood testing.
Okay.
And if the blood testing shows that you could, especially if you're really low, but if you're even within the normal range but get you the higher end of the normal range, often that'll make you feel a lot better. Okay.
So conventional doctors, they test for certain thyroid normally, correct?
Yeah, it gets kind of complicated because this is a picture I pulled off the internet. So thyroid can be really very complicated. I'm not going to go over this because it's really difficult to understand. But historically, if you go to your regular doctor, your primary care doctor, they'll often do the TSH and sometimes they'll do the T4. And that's what they base their thyroid testing on. Historically, this is a picture that I use here. I kind of drew that myself, obviously, but to kind of make the thyroid more understandable, this is a picture of a body. This is the brain. That's a pituitary gland, makes TSH that controls the thyroid gland, which is this little butterfly organ right here in the neck. And the thyroid gland makes T4, and T4 gets converted to T3. T3 goes into the cells and tells the cells what to do. of all of these hormones here, T3 is really the most important one because that's the one that gets into the cells, hits the cell receptor, and tells the mitochondria to make more ATP. And most cells in the body have thyroid receptors because a lot of things in the body run on ATP. It's the little battery that's in the cells and tells the cells what to do. It gets enzymes working. It gets stuff in and out of the individual cells. So if this is low, even if it's in low normal, things are just going to function a little bit more sluggishly than they do if things are optimized in here. Historically, in the 60s is when thyroid testing first came to be, and the first test was T4, and they really had a lot of problems with that. It took a long time. They had to use radioactivity to test it. And then in the 70s and 80s, they started developing TSH. TSH, again, is a brain hormone controlling the thyroid gland. It doesn't really directly affect what's going on in here. There's a feedback loop in here, and again, I'm trying to make this not too complicated here, but TSH has become the standard, the de facto standard, because there's a lot of issues with doing testing to check for T4 and T3. And even more important is the free T3 and free T4. Because if this is your total, a lot of the thyroid hormone is stuck onto different proteins, and the free T3 is really very small, and that's the stuff that gets into the cells. So historically, very, very problematic to do these two tests here because you had to do it at body temperature, you had to make sure that the testing itself didn't have enzymes or other stuff in there that screwed up the test. So the third generation TSH kind of became the gold standard, and that's the reason for it, is that was more consistent. The problem with it is if you just look at the TSH, it doesn't tell you what's happening downstream. And even if your TSH and the T4 are fine, if you're not converting here, or as you get older, if your receptor isn't working very well, it's not receiving that free T3. Stuff can be happening at the cellular level or not happening at the cellular level where this all here looks fine. And this is kind of conventional testing, looking at these two things here. And again, I see people all the time with a normal TSH, a normal free T4, or a total T4, and a low T3. And that's really what needs to be treated, and that's what we do. Again, I'm trying to make a very complicated subject be a little bit simple here.
Sure.
But getting this to the high end of the normal range, again, the range is sort of 2.3 to 4.2, and getting up people around 3.8, 4, 4.2, something like that, often makes them feel a whole lot better.
Okay. And how do you do so? Is it in a pill form? Is it injection form?
Yeah, thyroid medication's a prescription. Again, if you go to your regular doctor and you tell them you're feeling sluggish and the TSH is high, which means that the T4 is low, typically, they'll prescribe only T4. That's a synthetic hormone. It's Thyroid or levothyroxyl or there's other ones in that family. Thyroid is one. The problem with that is if they're going to check the TSH and the T4 by giving you T4 and making sure that's okay. But if you're not converting to here, these two numbers could be fine and you still could be functionally hypothyroid. Really hard to measure is if the cell receptors don't work, and that often happens when people get older. There's not really a great test for that. So the conventional medicine checks the TSH and the T4, but again, the sort of integrative medicine doctors will check those as well as the T3. There's yet another test that we check, and that's the TPO, or the thyroid peroxidase antibody. And what that is some people have something called Hashimoto's. It's an autoimmune disease where your antibodies are attacking your thyroid gland, and that can make the thyroid less efficient. It's not a horrible thing as far as being able to treat people, because people can have their thyroid gland completely removed, and we can treat them for replace their thyroid hormones.
Oh.
And Hashimoto's makes it less effective because it's plugging things up in there.
Okay.
So we just use that as a point of information and help us to figure out the treatment. Thyroid hormone is a prescription. T4, Thyroid, levothyroxyl, those are prescriptions that most people are probably familiar with. And we use something called Armour Thyroid or Nature Thyroid, and those are T4 plus T3 together,
okay.
And those are bioidentical hormones, just like everything else we use here.
And they're not synthetic, they're natural.
Not synthetic, right.
They're natural.
Yep.
Are there any side effects from taking thyroid medication?
If some people, if they're really sensitive to it, even if we get their T3 to the high end of the normal range, they sometimes can get palpitations, and we'd back off on it.
Oh, okay.
You usually have to go higher than that to have people feel like they're jittery or
had too much caffeine or something.
Yeah, and there's also people that will sometimes use thyroid hormone to lose weight. I think that's really a bad idea, because that's bringing their thyroid hormones too high, and it's almost like if you have a Ferrari and you're constantly redlining it and revving that engine, it's not good for the body to do that. It's not a good way to lose weight. There's much better ways to do that.
Okay. Well, I was wondering when Carol was on, she said that she had lost 40 pounds. It could be a result of having her thyroid hormone put in check with the medication?
Yeah, with her, it was really not the bioidentical hormones, the testosterone, the estrogen, or the thyroid being used as a weight loss. She's really one of the exceptions, and I think what happened to her is she felt better. She liked going to the gym better. She recovered better. So she kind of incorporated that into her whole lifestyle. And I think she even said she changed her diet.
Okay.
But she's exercising more too. So it's not a diet pill.
Yes.
That's not how that was given. And most people don't lose that much weight.
It's
they will
funny.
exercise better. They'll have more. They get more tone, more muscle. But not losing 40 pounds is an exception in this.
Yeah. Okay. Because I do hear my friends say, "Oh, I'm not losing weight. I'm stuck. It must be my thyroid." So even they have misconceptions about.
Well, it could be if their thyroid hormones are low. Again, the free T, if that's low, free T3, if that's low, then optimizing that can help them exercise better, and sometimes they'll lose weight from that. But weight gain is a lot of things. Again, at menopause, it's often estrogen, deficiency in estrogen, low testosterone, thyroid. It all fits together. That's why we look at all of them.
So, Dr. Walter, we're at the conclusion of this show, and I realize, obviously, that the thyroid is a difficult thing to discuss in a short period of time.
And complicated, sure.
So I'll just let everybody know that, feel free to give the office a call or visit the website, make an appointment with Dr. Walter. He can go over all the complications of the thyroid with you at that time. I want to thank the guests that were previously on, Gloria, Stephanie, and Sean. They were great. We had a great time with them. And I want to say a big thank you to Acton TV, and we'll see you next time.